Dr. Dimitri Daskalakis, former director of the National Center for Immunization and Respiratory Diseases at the CDC, and Dr. Deborah Howry, former CDC chief medical officer and an associate professor at Emory. Both resigned from the CDC back in August.
Dr. Daskalakis, I'd like to just sort of get to where I think Alicia took us in setting this up, and that is the impact that this is starting to have on moms out there. And what should moms and dads in places like South Carolina and elsewhere where we're beginning to see an outbreak in measles, for God's sake, right? What should they be concerned about right now? What is their recourse? What avenue do they have to protect their children if the federal government, under the leadership of Donald Trump and RFK Jr., really have demonstrated they don't care about the data, they don't care about the response, they don't care about the infection rates? What are parents to do here?
I think when there's a vacuum in the federal government, which is what I think we're experiencing, I think parents need to rely on the most trusted person in their relationship with their children, which is their pediatrician. And so I think that they need to make sure that they're connecting to their pediatrician, talking to their pediatrician, and making sure that their kids are up to date with the measles, mumps, rubella vaccine. 2 doses are 97% effective in preventing measles. It is one of the best vaccines that we have in the world. It actually prevents the disease. 97% is its effectiveness. And, the bottom line is that's the way to go. And, along with your pediatrician, look to your local health department and your county and your state, because they are trying their best to keep up with data and inform people about what's going on in their state.
You know what, Dr. Ari, as we were talking about this today, Alicia made the point that this is not new for the CDC, that the CDC has been a sustained target of this administration from the beginning. And I frankly don't think that's an accident. I think it's systemic, and I think it's a strategy. We talk about the authoritarian playbook a lot, and oftentimes they attack the facts first. That's the journalists, right? But that also includes the scientists. And so what we are seeing at the CDC is a part of this sustained strategy. And I just want to read this to you from NPR. With new cuts at CDC, some fear there's nobody to answer the phone. Those fired include CDC staff who brief Congress, those who work on health statistics and chronic disease. It also affected CDC support staff, such as those at the CDC library, those who provided mental health support after an attack at the CDC's main campus in August, and human resources staff who were called back from furlough to lay off colleagues and members of their own team. This seems quite intentional.
I think what I'm concerned about is it's just really leaving the agency not ready to protect all of us in the United States when you don't have HR to bring people on when needed in a pandemic. I know the Injury Center had to bring several people back already just to respond to overdoses in communities because they were furloughed. And when you don't have conflicts of interest to review the Federal Advisory Committee that the Secretary has made a priority, that's concerning. I think, having been at CDC and worked with so many physicians, scientists, and really dedicated staff there, they want to protect all of us in our health. But when they're facing these staff cuts, and even as you mentioned, not having the mental health services for themselves, it puts them at risk as well to be able to protect us.
Well, and it's also, Dr. Daskalakis, really shifting the responsibility to states. I want to read you just a little bit more of the reporting from State Line about the ways in which states are having to step in and fill the gap. The shutdown has halted dashboards and expert analysis from the Federal Centers for Disease Control and Prevention. The pause leaves states with less early warning on disease outbreaks, potentially endangering lives, even as child vaccination rates drop amid increased exemptions and hesitancy fed by misinformation. So 2 questions for you, Doctor. One is just, can you draw a picture for us of what that looks like when a state, without the benefit of the federal government, is being left to determine whether or not there is, in fact, disease outbreak? And 2, talk just a little bit about the fact that we now have 2 storms that are colliding. You have these cuts to the federal workforce colliding with the misinformation about health and vaccines.
Yeah. I think CDC, what it provides to local government and state governments is expertise in at least in my universe, in pathogens specifically. So whether it's measles or another bacteria or virus. And so sometimes states will have great expertise. Sometimes they don't have great expertise. So CDC is able to fill the gaps and provide the technical information that they need to be able to have effective responses and share effective data. I worked in a local health department, one that you know pretty well in New York City. And very often we would take CDC data and just reprocess it to make it visible to folks in the city. And so that's what happens. So in some places, they rely fully on CDC's analysis and CDC's data visualizations to be able to communicate to the populations that they serve. And so when that vacuum exists, there's not anyone there who can potentially fill the gap. So, the bottom line is CDC is important. It fills a very important mission. Not being able to do the mission means it gets transferred down to the state. And your second question, it is a perfect storm. And so, the sort of scenario where we have outbreaks and misinformation and, the sort of patchwork reduction in force at CDC all means that, as Dr. Oury said, the U.S. isn't prepared not only for a big outbreak, but for a medium outbreak or even the seasonal outbreaks of RSV, flu, and COVID-19. In fact, because of the shutdown, those dashboards haven't been updated at all.